Hello, you're welcome to the teacher channel and welcome to a brand new video. And this video I'm going to talk about basic life support. It's going to be in a nutshell, which means it's actually going to be a summary of what basic life support course is all about. I'm not going to actually talk comprehensively about BLS. Rather, I'm going to focus on some aspects of BLS, especially CPR, AED, and choking. So it's going to be a summary of BLS. But I'm not going to talk about some components of BLS like anaphylactic shock and other chain of survival and other components. Okay, but just as I said, the focus will be on CPR and then AED and choking. By the way, BLS is a certificate, is a separate certificate, is an independent certificate. So there's a course we call BLS. This is a 4-hour training for those who are taking the course for the first time, or for those who are renewing, it is 2-hour training. So I'm going to try to condense the content to within some minutes. So the majority of what I'm going to say in this presentation will come from this manual. Okay, Heart and Stroke BLS Provider Manual 2020. So there are also some important disclaimer here. So this presentation does not replace the actual BLS or CPR training. So there's a training, there's a course, an independent course, BLS or CPR for healthcare providers. So this presentation is not a replacement. Nor does it replace the course manual. So there's a book, the manual for this course, so this is not a replacement. Rather, it should be seen as a complementary tool. It's a complementary resource to be used before or after the training. It is recommended for those who are preparing to take this course. It's going to be very helpful. It's going to be very insightful. It is actually going to make that training a lot easier for you, because with this, if you can assimilate, if you can go through this, you see that it is going to facilitate the understanding of the course when you attend. So definitions in the presentation, I'll be using victim, casualty, or patient interchangeably, and those three terms refer to a person involved in some emergency, e.g. cardiac arrest. So whether I use victim or casualty or patient, I am referring to the same person. Who is that person? Somebody who is involved in some emergency requiring urgent attention. Example is somebody in cardiac arrest. I also going to mention CPR a lot of times. And when I do, I am talking about cardiopulmonary resuscitation, There are 3 age groups that this presentation will be talking about: infant, child, and adult. Who is an infant? An infant is someone who is under 1 year. Under 1 year, that is an infant. A child is someone who is over 1 year but has not reached the puberty. So a child is above 1 year but has not reached puberty. That is a child. Adult is someone who has already reached puberty, somebody who is going through puberty, somebody who has already gone through puberty. That is an adult. Assessments. The patient must be assessed to determine if CPR is necessary. Okay, so you must assess, you must do some assessment. Number 1, you need to check for safety. Safety is important. You must make sure that the scene is safe before you proceed. Check up, check down, check around you. Use all the sense organs. And make sure that the scene is safe. Make sure that your life is not in danger before you move 1 step forward. Number 2, obtain permission or consent. Okay, so there are 2 types of consent: voluntary or informed. This one is usually given explicitly by somebody who is conscious, somebody who is of age, who is legally capable and able to give consent. There's another type of consent called implied consent, usually from somebody who is not able to give explicit or verbal consent. Maybe that person is unconscious, or that person is not able, or maybe the person is under age, like a baby. Number 3, check if the patient or if the victim is responsive or conscious. So you have to make sure that this person is conscious. You have to make sure that this person is responsive. Okay? In a child or adult, all you need to do is to tap and shout. So you tap the shoulders of this person, gently tap the shoulders while you shout, "Are you okay?" For a baby, what you have to do is to tap one of the feet, yes, one of them, and then you say, "Are you okay, baby?" As you tap one of the feet, you also say, "Are you okay?" So what you're doing here is to see whether the person is reacting, whether the person is able to react to any stimulus around the environment. So responsiveness, consciousness check is required, and then so you check the person for normal breathing. So check if the person is breathing normally. So it is also important to highlight that agonal gasps are not normal breathing. So if somebody is having this type of breathing, we call it agonal gasps, that person is as good as not breathing. So you need to check the person for normal breathing. You also have to check the pulse. Okay, so if this person is a baby, you do what we call brachial pulse check, which is actually done between the shoulder and elbow. Okay, that is where you get the brachial artery. So that is the best place to do the pulse check for a baby. Okay, if the victim is a child or adult, then you do it on the neck. Okay, so there's a big artery that takes blood to the brain. So that is where you check. We call it carotid pulse check in children and adults. Assessment outcomes and the actions. Call 911 if patient is unresponsive or unconscious. So when you have done your check, "Hey, are you okay?" You tap and shout. If this person does not respond in any way, that person is unresponsive, that person is unconscious, you have to call, you need to activate emergency number there. EMS, you have to call them emergency medical services, 911, or any emergency number known to you, you have to call, because this is a medical emergency when somebody is unconscious, when somebody is not breathing. Now, you start CPR only when the patient is unresponsive, not breathing normally or just gasping, and no pulse. So those three conditions must be there as far as BLS is concerned. Condition number 1, this person must be unconscious. Number 2, this person must not be breathing normally. And there is no pulse. Unresponsiveness, not breathing normally, no pulse. Those three conditions must be complete before you can start CPR on anybody. Otherwise, you cannot. No CPR will be needed if any of those conditions are missing. And in that case, you have to consider other first aid cares. The person doesn't need CPR if any of those conditions is not there. So again, let me highlight, for you to perform CPR on any victim, that person must be unconscious, not breathing normally or just gasping, and has no pulse. And this is the reason why you need to do those assessments first. This is the reason why those assessments must be done before you determine the direction to go. CPR details. CPR comprises of chest compressions and breath. So there are two things that make up CPR: chest compressions and breath. Objective. So why do you perform CPR? Why do you perform CPR? To keep oxygenated blood flowing through the body during cardiac arrest. Remember that cardiac arrest will stop the heart. And when the heart stops, it won't pump anymore. And of course, you know that this is so deadly. Okay? Without the heart pumping, life is no more. So for life to continue, for this person to have a chance of surviving, oxygenated blood must be flowing through the body. How is that done? Through CPR, cardiopulmonary resuscitation, manual pumping. So somebody is manually pumping, manually compressing the heart and giving breath, so that the oxygen will keep on going, keep on distributed through the body. So there's what we call compression only CPR. So in this case, only compressions are given, but no breath. Remember that standard CPR comprises of chest compressions and breath. So, but compression only CPR is only done, comprises only chest compressions. Chest compressions, no breath in this case. Now, why? So there are situations where you may do only compression and no breath. One is you don't have pocket mask and you don't feel comfortable to do mouth to mouth. That is just one instance. Okay, in that case, you keep on compressing the chest until somebody brings the pocket mask or EMS comes. Rescue breathing. So another special situation, what we call rescue breathing. And in this case, an unconscious victim has pulse, which means the heart is working, but no breathing. Maybe this is as a result of respiratory arrest or respiratory problem. So the problem here is respiratory in nature, not actually cardio, not actually the heart. The heart is pumping, so there's pulse, but no breathing. So meaning it is respiratory in nature. So in that case, since the heart is working, you don't have to do compression. Since the lungs, the issue is respiratory in nature, that's why you have to focus on breathing, giving this person breathing. So only breath are given in this type of situation where the heart is working, there is pulse, but the person is not breathing. So if the victim is an infant or a child, and they're doing rescue breathing, you give one breath every 2 to 3 seconds. Remember, you're only focusing on breath in this case. So you give one breath every 2 to 3 seconds, one breath. So the breath should be given over 1 second. So one breath for 1 second. Check the victim's pulse every 2 minutes. Okay, so you continue this rescue breathing, and then every 2 minutes you check the pulse, make sure the pulse is still there, which means the heart is still working. Okay, if this person is an adult, if the person is an adult, you give one breath every 6 seconds. One breath every 6 seconds. Okay, for an adult who has pulse but no breathing, and you give one breath every 6 seconds. And of course, that one breath should be given over 1 second. And you also have to check that person's pulse every 2 minutes. Types of rescue scenarios. So there's one rescue scenario. In this case, only one person is doing the resuscitation. So one person is doing everything in this case, one scenario. Then there are 2 rescue scenarios. So one rescue scenario, one person, 2 rescue scenario, at least 2 or more persons resuscitating the victim. So 2 rescuer, you have at least 2 people. 1 rescuer, of course, is 1. So in that case, there are some differences. If one rescuer, and so one rescuer, the compression ventilation ratio for one rescuer is 30:2 for everybody. So if you are the only one doing this, so the compression ventilation ratio is 30:2 for every person, whether it's a baby, a child, an adult, it doesn't matter as long as you are one person doing the resuscitation. So it is 30:2 breath, 30:2 breath, you continue. But if you are two or more, then for baby and child, the compression ventilation ratio will change to 15:2, while adult is still 30:2. So in adult, for adult, it doesn't really matter whether you are the only one or whether you are other people helping you. So the compression ventilation ratio remains 30:2 for adult in all cases, in all scenarios. But in 2 rescuer, it becomes 15:2 in children and children and infant rather. So infant, child, 15:2 for 2 rescuers. 1 rescuer, 30:2. 32, 30 chest compression followed by 2 breaths for everybody, 1 rescue, and 2 rescuers is also 30 and 2 for adult only. Okay. How CPR is performed. If safety is okay and consent is sought and obtained and all the conditions for CPR are met, then knee beside the victim, who must be lying in a firm, hard surface and in a supine position. So this person must be face up, lying on a hard and firm surface in a supine position. Locate the center of victim's chest, sternum. Place 2 hands there if an adult. So 2 hands are used for adult. Place 1 hand there if a child. Unless you are not sure. In that case, you can use 2 hands. You can also use 2 hands in a child. Okay? But if a baby, you use 2 fingers or 2 thumbs in a 2 rescuer scenario. Okay, so 2 hands for adult, 1 hand for a child usually, and 2 fingers in 1 rescuer, or 2 thumbs when you are 2 or more. So then start the high quality CPR. Okay, so when you have net beside the patient, locate the center of the chest. Place, your hand, 2 hands, 1 hand, or 2 fingers, or 2 thumbs, depending on who the patient is. And then the next is to start a high quality CPR. And when you talk about high quality CPR, I'm going to talk more about high quality CPR soon. So you start high quality CPR. Which consists of cycles of X chest compression followed by Y breath. And here X could be 30 or 15, or 30 or 15, and Y is 2. So which means 32. Okay, we have already seen this table. So that's what we're talking about. This is X, this is Y. So this is X, this is Y. This is X, this is Y. So 32 in this scenario for everybody. 15 2 for child and infant and child for 2 rescuer, but it doesn't change if the patient is an adult. So that's what this expression means here. So cycles of 30 chest compression followed by 2 breaths, or cycles of 15 chest compression followed by 2 breaths, depending. So high quality CPR. For CPR to be considered high quality, it must have the following attributes or characteristics. So this is very important. Number 1, this is very, very important. Push hard and fast at the center of the patient chest. So you have to push hard and fast. Okay? And this does not depend on age. It doesn't matter if it is a baby. It doesn't matter if it is a child. So you are required to push hard and fast at the center of the patient chest at a rate of 100 to 120 compressions per minute. So in 1 minute, you should be hitting that number. If in 1 minute you are not getting that number, 100 to 120 compressions in 1 minute, if you are not getting that number, you are slow. Or if you are getting number more than that, if your compressions are more than 120, in 1 minute you are too fast. So depth of compression, if infant is about 4 centimeters or 1.5 inches or 1/3 of the infant's anterior posterior diameter, AP. If a child 5 centimeter deep, so this is how deep you should compress. 5 centimeter in a child, which is about 2 inches, or 1/3 of the child's anterior posterior diameter. So adult is 5 centimeters or 2 inches. So these numbers are very important. For baby, about 4 centimeters, 1.5 inches. Child, 5 centimeters, 2 inches. Adult, 5 centimeters, 2 inches. This is how deep to guarantee that the heart is actually compressed. That is the target. That is how deep you should compress. Allow full chest recoil, 100% recoil. 100% chest recoil between compressions to allow blood to return to the heart via the right atrium. So this is what we call diastolic. So the significance of number 4 attribute is that it allows the blood to return to the heart. So for that to happen, you must allow the chest to recoil fully between compressions. Maximum interruption of 10 seconds. So there's a repeat there. So interruption of maximum 10 seconds. So if there, even though we don't encourage interruption, but if it is unavoidable, you should not allow more than 10 seconds of interruption. Giving breath, pocket mask is preferred in a 1 rescue scenario. Back valve mask, BVM, is preferred in a 2 rescue scenario. So when you are, remember you need to give a breath also. Okay, so steps: open the victim's airway. So do head lift, chin lift. To open the airway, do head tilt, chin lift. Deliver 2 breaths over 2 seconds. 1 breath per 1 second. You have to watch for visible chest rise. Watch for visible chest rise. So as you blow, you must watch the chest. Make sure that the chest is rising. That is the only evidence that your breath is actually inflating the lungs. Visible chest rise. You have to watch for that. When to stop performing CPR on a victim: number 1, victim begins to breathe normally. Number 2, the compressor, the person who is doing the chest compression, becomes too exhausted to continue. Number 3, the safety of the compressors or the compressor, the person who is doing the compression, is no longer guaranteed. If anything happens and your life is in danger, the safety is no longer there. It is too unsafe to continue. Of course, you have to discontinue. The EMS arrives and takes over. Remember, you call them. You call them before you start CPR. Okay, so you have to stop performing CPR once they arrive and take over from you. Another stopping condition is a bystander taking over from you. A bystander could be a co-worker, it can be any person passing by who knows how to do it and who comes to you to relieve you. So in that case, you stop. So let's briefly see automated external defibrillator, AED. So this is a computerized lightweight device which can give electrical shock to the heart. What is the purpose of AED? It detects abnormal heart rhythms, eliminates abnormal heart rhythms, and restores normal heart rhythm. I already have about 3 videos on AED. 3 videos. So maybe you have to watch that video if you have not. Okay, important. Chance of survival doubles or triples when AED is combined with CPR. So that is why you need AED, because it doubles or triples the chance of survival. CPR is important. AED very important. Combining 2 of them will give you the best result. Okay, so that's the importance of AED in conjunction with CPR. Steps to using an AED. Turn it on. Step number 1, turn it on. Step number 2, listen to the voice prompts. Okay, number 3, obey the instructions exactly as given by the AED. So once you turn it on, you listen, it begins to give you instruction. Just obey, follow. Follow them exactly the way AED is dishing them out. Place pad as shown on the pad. Clear the victim when AED analyzes. Clear the victim before pressing the shock button if AED recommends shock. Start CPR immediately after shock is delivered. AED special considerations. Pacemaker. So never place a pad over a pacemaker. So some people may have pacemaker on at the exact spot where you place AED pad. So if that is the case, you need to move the pad below the pacemaker. Hairy chest, you have to shave it. If you have a razor, or you wax if you have extra pad. And you can only do this if hairs are preventing the pad from sticking. Wet chest, wipe the chest. Remove victim if laying on a wet surface. So if the victim is lying on a wet surface, you have to move that patient away, because AED is electrical. It can shock everybody if you use it in wet environment. Medication patches. If the medication patches is on the way, if it is at the location where you're going to place any of the pads, you have to remove that patch, the medication patch, wipe the area, and then place the pad. In other words, you should not place the pad on top of medication patch. Pregnant woman, it is okay to use it. Choking. Choking happens when a foreign object obstructs the airway, either partially or completely. Two types of choking, namely, so there are two types of choking: mild and severe. Okay. Mild choking is as a result of a partially obstructed airway. Okay, so the airway that starts from the nostril and ends at the lungs. So if the airway is partially obstructed, that will lead to mild choking. Again, I have some presentations, some videos on choking already. So mild choking is recognized usually by loud cough. So loud cough is usually present. So what do you do when somebody is in this type of emergency? Encourage the victim to cough while monitoring his or her airway, breathing, circulation, ABC. Okay, so you encourage. The person is already coughing, which is the best thing to do to clear the foreign object that is obstructing the airway. So coughing is all that the person requires. So encourage the person to keep on doing the right thing. Severe choking is another one. This is deadly type, that is as a result of completely obstructed airway, very deadly. So something is blocking the airway from one end to another end. So oxygen is not going in, and carbon dioxide is not leaving. So this is very, very, very critical. Victim may not make any sound. Universal choking sign may be seen, so the person may be holding the throat. So this is a way to announce that the person is choking, since the person may not even talk because the airway is completely blocked. What to do if that is the case? If somebody is choking severely and the person is conscious choking infant. So this is a baby and that baby is severely choking but is still conscious. So hold the baby, hold the infant face down on your elbow. So relax this baby on your elbow with the head slightly lowered. Okay. And then deliver 5 back blows followed by 5 chest thrusts until the obstructing object goes away and victim begins to breathe normally, or the victim goes unconscious. This will happen with time unless the object goes away. So you keep on giving 5 back blows followed by 5 chest thrusts. Keep on alternating, alternate the 2, 5 back, 5 chest. Keep on doing that. Hopefully the object will pop out, will go away, and the baby begins to breathe normally. Otherwise, with every passage of time, this person, this child, this infant, this baby will be tilting toward unconsciousness. So if the victim is a child or adult, so what you do in this case is you give abdominal thrust or chest thrust if large victim. So you need to give abdominal thrust, which is usually done above the belly button. So you give that thrust to expel the object. So you continue doing this until the obstructing object goes away. Otherwise, this person will go unconscious in a matter of time. It is a matter of time, so the person will go unconscious. So if the person goes unconscious, okay, so before the person is conscious and you try to relieve the person, what if the person is not helped, the person is not relieved, now the person goes unconscious? Whether it is a baby, whether it is a child, whether it is an adult. If that is the case, gently lower the person on a firm surface. Okay? So gently lower the person face up, supine position. Call 911. Start a high quality CPR, chest compressions, 30 chest compressions or 15 chest compressions, depending on whether you are the person you are dealing with or whether you are one person or 2 persons, as we have already discussed. Now, breath, 2 breaths. Look into the mouth. So before you give breath, you need to do a modification. Look into the mouth. If you see the object, carefully remove it, but don't do this blindly. No blind finger swipe. You must see it before you remove. Okay, so team dynamic, this is the last slide here. So team dynamics, this is when you work in a team of at least 2 people. So in that case, clear roles and responsibilities must be established. Okay, the communication is important here. So every team member must know what he or she is doing. Okay? Knowing everyone's boundary, which is decided as limitation. Your team members may have some limitations, so it's important for the team leader to know what you can do or what you cannot do. Those are the things we call limitations. It could be health imposed limitations. It could be that your scope of practice may not allow you to do some things. So, but most of the limitation we're talking about here is, things you cannot do because of health issues. So we need to know if you're working in a team so that somebody will not give you tasks that you are not able to do effectively. Positive, provide constructive or positive feedback. Provide constructive or positive feedback. Okay, how you correct somebody, a team member who is not doing it well, is important. How do you correct the person? This is important. This is important. Okay, so it is always good to provide constructive, positive feedback to team members. An example is if somebody is not compressing deep enough, you can tell the person, I notice that you are not compressing 5 centimeters if a child or adult, or maybe the person is not going at correct rate, 100 to 120 compression per minute. Just I notice you are not going at the right rate, 100 to 120 in 1 minute. Important notes: alternate compressor every 2 minutes in 2 rescue situations, or when the compressor becomes exhausted. Yes, so every 2 minutes you should change that this compressor, because this is very, very tiring. Chest compression is tiring. So every 2 minutes another person should take over, or if the person becomes tired sooner than 2 minutes. So switch the compressor when AED start analyzing. That is another time to switch. So if you're in a team environment, so you either switch using 2 minutes as your guard, or when the AED says analyzing, that is when you switch. Okay, I believe you have learned a lot, and so I look forward to you watching some other videos. If you have not watched, I have videos on CPR, I have videos on AED, I have videos on choking on the channel, so you can watch them if you have not. And you can also subscribe. Please like, share also. This is about saving life. It is important. You can share it to family members, share it to your colleagues, give me some comment also. And remember to turn on your notification bell so that when I upload new video, you are going to get notified, and that way you can watch. So thank you again for watching, and I will see you again in my next presentation. Bye for now.